Wallis, first year adult nursing student. Basically a bit about me, I'm 35, which means I'm technically a mature student. And I came into nursing quite late. Never really considered healthcare as a profession for myself. Basically worked as an ecological consultant for 10 years. And it wasn't until I kind of experienced quite an intense sort of experience with a loved one being looked after by sort of various healthcare professionals, and I was sort of caring for them for about sort of 3 years. And it was while I was doing that a nurse basically turned around to me one day and said, "Have you ever considered a career in nursing?" It was kind of the first time a sort of light bulb went off, and I thought, actually, you know what? Yeah, I could definitely do that. And not one for living with regret. I basically looked at it and thought, you know what? I don't want to turn around in 10 years' time and not and sort of sit there and go, you know, I really should have done that nursing course. So, you know, if I can give you a piece of advice, if you're thinking about it, go for it, do it. You know, it's probably the best thing I've ever done. The first year itself is brilliant. It's a very general first year, so everyone sort of does the same thing. So all sort of adult nurses, child nurses, learning disability and mental health nurses do a generic first year, and it's good because you get a chance to do other fields of practice for your placement, so you're not necessarily guaranteed to sort of be on your field of practice. So for example, I'm doing adult nursing, but for my first placement I actually ended up in a over 65s mental health ward, which actually I'm very thankful for. It's a great experience. I was able to practice everything that we'd done in the sort of theory and practice side of it. And yeah, so it was a great experience. Now I'm on my second placement, and it's completely the opposite. I've gone from, say, a 9-bed ward to a 30-bed acute ward, which is sort of very fast paced, very long hours, very stressful, but really, really, really good. And I suppose the only other thing to say really about the course is you can do as much or as little as you want. Sort of externally, you've got the coursework to do, you've got your exams and your placements and things like that. But kind of, I suppose the world is your oyster when it comes to other things. I mean, you know, I've done the sort of nurse vice presidency for this year. I've been working with the Marrow Society, which is the student side of the Anthony Nolan charity, and I'm actually going to be their volunteer coordinator next year. You can sort of get involved in the academic side of things as well. I actually gave 15 minutes of a lecture. Another student and I were sort of interested in looking at what our sort of friends and family thought about what we as nurses did. So we did a bit of an online survey, got over 200 responses, and actually stood up in Helen's professional identity lecture and actually gave the results of those that survey to the other students, and sort of invited their feedback. And yeah, I think there was a few shocked faces, but no, it was a really, really good session. I sort of play a bit of hockey as well for the college, so you can do as much or as little as you want. It's entirely up to you. You know, there is time for it. Don't let anyone tell you that you don't have time for all these other things. As long as you plan your time well, then you can do whatever you like, really. So yeah, come to York, enjoy it.